Hi viewers, and welcome to another episode of Afya, Yetu. We are live from the Alps Hotel, and to begin the show, we have an SMS line and WhatsApp on 0736 991958 and 011 258. You can also catch us live on Tumaini TV KE YouTube and Tumaini TV on Facebook. And I'm your host, Cynthia. Together with me, we're with a panel. It's the same panel, but now we bring the next episode of Infertility. And to my right,
Collins Ndoe.
And I'm Dr. Edwin Oyogi.
So today we're going to continue with the infertility conversation. And last time we agreed that infertility is a sensitive issue, but we're going to deal with it the way we think medically it should be dealt with. And so to start us off, I would like to just remind us what infertility is. Let's start, Collins.
Okay. As previously said, we said that infertility is just an inability to conceive after 12 months of unprotected sex, 12 months frequent unprotected intercourse. So you get maybe you cannot conceive within that period, but it's not like a cast and stone. We narrow it down to age, because you get maybe for somebody in her 20s, if she cannot conceive within the 2 years, we won't be worried. But somebody past 35 years, that's for women, because chances of getting pregnant decreases with age in ladies, but in men it's it doesn't increase with age with men, but you get maybe when a person gets to 90 for a man, there's cessation of production of sperms, because the testosterone now cannot be produced. But for a lady, it's a bit confined to age. Yes.
Okay. And so today we want to talk about the fertility factors. These are factors that are causing infertility, and we're going to dwell on how to manage these factors. So to begin, we want to talk about the Tubal factor. Daktari, can you please enlighten us about the Tubal factor?
Okay, actually the Tubal factor affects mostly the female, and you realize there are issues that usually happen there, especially with their infections and all that. So the tubes end up being blocked. So when they're blocked, the egg cannot be released and pass through the tube to the uterus. And again, the sperm cannot meet the egg to fertilize it. So that is actually a serious factor that affects most of the women. And if we speak of management for the tubal factor, mostly it's more surgical. It's more surgical. And I cannot explain the procedure with the surgery about it. And the percentage of for somebody to get pregnant is usually around 15% after the surgical procedures.
Just to add on what Dr. has said, the funniest, not the funniest, but the uniquest thing about infertility is it's a disease for the two. Many a time we go to the hospital as an individual and you'll be diagnosed as a person. But now this is a disease for the two. So you have to tag along your partner. So you get also in the tubal factor also affects the male also, because you see from by now I think our viewers really knows that the sperms is produced specifically on the testes. And from the testes, we get this vast epididymis, where it's just a small place where these sperms are stored and they mature also there. Then from the epididymis, they follow the sperm duct. And to us, we call it the vas deferens. Then from the sperm duct, they go to the posterior to the prostate, where they meet the ejaculatory duct. Then from the ejaculatory duct, they go to the urethra. Then from the urethra to the penis. Then there is an ejaculation. So if by any chance there is anything, because those are the tubes, because from the testis to the epididymis, So if there's any blockage or there's any anatomical defect in that tube, there'll also be a problem with the ejaculation. And just to maybe to clarify a bit, because maybe we'll be just talking about the blockage, and maybe our viewers or anybody watching out there might not know some of the causes of the blockage. So some of the causes of this blockage, one is anatomical defect. So maybe it could be acquired or congenital. Maybe you have a congenital abnormality of the ducts. Also, maybe if you have a condition like cystic fibrosis, you'll get that the tube will be affected. Maybe you have a tumor, it will block the pipe or the tube. Or maybe you have an infection, like maybe gonorrhea, chlamydia. It will also block the tube. So if you have any defect from where the sperm is being produced to where it's being ejaculated, in that line, there'll be a tubal problem. Yes.
Okay. And so just to continue on this, we also have something like the cervical or uterine factor. Are they related to the tubal factor?
Yeah. Okay. The cervix, the cervix is like it's a connection between the vagina and the uterus. So if cervix is just a passage, it's not a tube per se, but if we go to the fallopian tube, is a tube. Yeah. So if maybe you have maybe something like cystitis, cervicitis, sorry, you get that the sperm will not pass. Or maybe CA cervix, you have the cancer of the cervix, it will interfere with the passage of the sperms. And maybe other conditions which might hinder the movement of the sperm also is maybe if you have a low pH in the vagina, because sperms work so well in a basic environment.
Okay, actually to add on,
yeah.
She asked about the cervical and uterine issues, if they're related to the tubes.
Yeah.
So mostly that is why I was talking about the infection.
Yeah.
Because if you get cervicitis, it gives you something called pelvic inflammatory disease.
Yeah.
So it goes up to the tubes and all that. So by the end, at the end of it all, like a complication, you realize that the tubes, they end up being blocked, like something called adhesions.
Yeah.
Yes. Maybe after treatment or just like a complication of it. Yes.
Yeah. So we are done with, or I can explain a bit of. Okay. Now the tube, the fallopian tube. Like if you look at a woman reproductive system, you see we have as we have alluded to, we have the vagina out, then the cervix, then the uterus, then the tube, then the ovaries are somewhere here. So if you get maybe like Dr. Yugi has alluded to that, if you get any infection, an infection can go all the way to the tubes, like an infection like TB. Then it beats the tube, the fallopian tube. So you get that the ova will come to the tube, but it cannot move. Then those are the cases now you get something like ectopic pregnancy, or you get that there's a pus accumulation in the tube secondary to an infection. So you get there's a blockage. Or maybe you get maybe this person had some surgery done on the perineum. So after the surgery, you get there are things like adhesions which interferes with the tube. Also, you can get maybe this person had God forbid, maybe he had an ectopic pregnancy, and now the surgery was done on the tube. So you get there's adhesion and there's blockage in that tube. So probability of that egg passing to the uterus is so reduced.
Okay, to still add on the tubes, what I can say is that eggs are usually released from the ovum.
Yeah.
Okay, in the layman language, people usually call them eggs.
Yeah.
So they are being released from both sides. So as they are released, you realize that sometimes the surgery that was done on one side of the tube, but the other side is parted. So you cannot say that this person may not get pregnant or something like that. There's a question that people usually ask, I was done surgery and one tube was removed. Yes. So they can still get, yes.
So now, we've spoken about to this cervical or uterine factors. Are the men affected by this, something close or similar to, or what, and what is theirs called? Like now we know cervical is very female. So what do the men go through?
Okay, we can talk about, as Colin said, infections, infections in the testes. So when you get these infections in the testes, actually they usually reduce the sperm count, and also they bring out abnormalities of the sperms. So you realize you don't get enough sperm at a quality. So that one actually happens. Yes.
Then,
sorry.
Okay. Then just to maybe that for sperms to be produced, like it's a central thing because it has to start from the brain coming down.
Yeah.
So you get, if there's a problem with the brain, you cannot produce sperms. Specifically on the hypothalamus, a part of the brain by the name hypothalamus, and some part called the anterior pituitary. That we get in the hypothalamus, we get this production of this hormone by the name gonadotrophin releasing hormone, which goes to the...
Let's come back to Kenya.
Put it in a way that they'll understand, so that, like, let's say maybe...
Okay, it's easier to put it like there are these chemicals released in the brain.
Yeah.
Exactly. So they go and affect the testes.
Yeah.
So that testosterone is
released. Okay.
Exactly.
What I wanted to say is, if you have a problem maybe in the brain, like let's say maybe the lower part of the brain where you get that the pituitary seats, it's called the telatosita. So maybe you had an irradiation on the brain, maybe you have a tumor, like a cancer on the brain. So you get that there'll be interference in these chemicals, the letdown of these chemicals, which can give you like two conditions. So like something called the primary hypogonadism. Okay. So you get that when there's interference with these chemicals, there'll be no sperm production. Now these things can be either genetic or acquired. Okay. So like acquired, maybe you can say the person has a tumor, and maybe there's an infection in the brain. So there'll be interference. So those are just male factors which are more central than peripheral. because you see, if there's, because, like, let me just explain that point, then maybe doctor will put it in a simpler version. So you get this part of the brain by the name hypothalamus. The hypothalamus releases a certain chemical, we call it human gonadotrophin releasing hormone, which comes to the anterior pituitary to stimulate the production of luteinizing hormone and follicle stimulating hormone. The follicle stimulating hormones comes down to the testes where it initiates the production of the sperms. So when it initiates the production of the sperms, we normally call it spermogenesis. So there will be production of those sperms. So if you get this interference with the part of the brain, hauta produce sperms at all. So hapo ndio tulikuwa tunataka kusema that as we even maybe if you have matters to do with maybe psychological issues, like you are the mental health advocate, there'll be interference with these things. Doc, you can put it simple now.
Actually, somebody asked a question about stress, if stress can affect infertility. Yes, true, it does, because it affects the brain itself.
Yeah.
So the same system that you're talking about, chemicals being released in the brain,
Yeah.
they go down and affect the testes.
Yeah.
It's the same chemical. Okay. The same pathway. The same chemicals affect the ovaries.
Yeah.
And when there's anything in between, like there's anything affecting the brain, definitely they're going to affect the ovaries and they're going to affect the testes.
Yeah.
So there'll be no ovulation and there'll be no production of
sperms, yeah.
the sperms. Yeah. So that's the simplest how. The simplest way. Yeah.
And Doc, to go back, you said something about abnormal sperms.
Yes.
So, do we have abnormal kids? Oh,
Yes, we do.
we do.
They're abnormal kids, yeah.
Interesting.
No.
Like, for example, we can say maybe a condition where you get maybe for a man, he has a 2X chromosome.
Okay.
Or for a lady or a woman, he has maybe 45 chromosome. So you get maybe this person is a man, but he has 2X chromosomes from the lady, which is XX, and 1Y chromosome. We call it Klinefelter syndrome, where you get this man has breasts. Those are early signs of infertility. You get maybe this person never got his or her puberty and any secondary changes in time. He's in his 20s, Anna beards. He's in 20s, then they start developing the breasts. He's in his 20s, you get, he's taller than his age, because one of the functions of testosterone in a man is it helps in the calcification of the bones. Okay. So get after a certain age, you cannot grow beyond there, because in early puberty, like before puberty, there's no production of testosterone. So you grow. After you start producing testosterone, the bones ossify. So after that, huwezi grow tena. But unapata maybe is taller than expected. So unapata there's testosterone haiko kwa mwili. So the bones keep on growing. For a lady, you'll get a very tall lady. For real.
Actually, what I feel is that we've deviated from
Infertility.
the management. Yeah.
No, I just wanted to know if they are abnormal kids, and he has answered their names. And so viewers will like to take a short break, and we'll be back. And if you have any questions, you can SMS us. Our SMS and WhatsApp lines are the same on 0736 991958, 01101000258. You can catch us live on Tumaini TV KE and Tumaini TV KE on YouTube and Tumaini TV on Facebook. Thank you.
Bwana, hiyo time imeishaje haraka bwana.
Welcome back. We're going to continue with the conversation, and we still remind you that sometimes courage doesn't roar. Courage is a little voice that tells you at the end of the day that you can try again tomorrow. And for this session, we want to talk about managing infertility. And in managing infertility, we want to understand, is there a possibility for another chance? And so to start us off, I want to start with you, Dr. How do we manage the male infertility?
Okay. With the management basically depends on, it's a case-to-case, like the way a patient presents, because we have different causative agents, different causative factors on infertility. So depending on, maybe after investigating this patient and you've gotten maybe there's a specific cause of infertility, and as we know that there's no one specific cause of infertility, there's always more than one causative agent. So maybe this patient comes to you in the facility. The first thing you'll do, you'll take a very thorough history. A very thorough history, maybe starting from the puberty. Okay. Not even puberty, when he was born for a man. Was, okay, he might not know, but I think maybe during a conversation with the father or the mother, maybe he was told, maybe when you were born, your testis was not descended. So maybe we did an operation to bring them down. So hizo ndio vitu zenye utaanza kumuuliza. Then after taking the history, knowing whether he had maybe undescended testes, when the puberty really started, when he started breaking the voice and developing beards also matters, because as we said before, we have these people with delayed development of the secondary features after puberty. Then also you'll take a social history. Does he take alcohol? Does he smoke? Okay. Does he maybe have does he do these hard drugs? Then, because they also contribute to infertility, then after that, you'll take maybe also a medical history. Does he have any chronic illness? Because if you have a severe chronic illness, like maybe liver cirrhosis, or any chronic kidney disease, or maybe you have a history of prostatitis, STDs, those are things you should elicit before doing any lab works. So after taking this history, you'll do an examination. You look for the breast if they have. Maybe you'll check for the testes. Maybe you can get the scrotum is there and there are no testes. Maybe if he has maybe a history of trauma or something called testicular torsion, it happens a lot in young men below 25 years because they are always around playing football and wrestling. So after doing all that, you can do maybe a laboratory check. Like Doc will take us through the laboratory works and maybe imaging.
For the male?
For the male, yeah.
Okay, because I wanted Doc to talk about management in women.
Yes, actually, in management, I'm going to be as brief as I can, but to be specific. Okay. What you said is important, taking the history and examination of these patients. It's so much important. But actually, management starts from the two of you coming to the health facility. Yeah? Whether affected or not, the one who is affected and the one who is not affected, both of you should be there. Two, patients should be given information about the kind of treatment they're going to be given, yeah, and the outcome. There's a possibility of it being successful or not. Yeah? Then lastly, I would say, not really lastly, for the female, what I would say, if you look at all those factors, yeah, we talked about infections. Yeah, you need to identify these infections and treat them. 2, we talked about the tubes. Yeah? Think about the surgical effects. We talked about the hormones, hormonal changes and all that, yeah? The ones that on the brain, affecting ovulations and all that.
Yeah.
The medication that can be used. But I'll tell our viewers, do not buy this medication over the counter. Make sure you've seen the doctor and he has advised you properly.
Yeah.
Another thing I'll talk about is we don't have to give up, especially because there's usually artificial insemination.
Yeah.
Yeah. You can get the tubes are blocked when
Yeah.
the ovaries are there.
Yeah.
It's easier to pick an ovum from there,
Yeah.
put in a test tube and the
Yeah.
sperm of the man,
Yeah.
then take it to the uterus.
Yeah.
You get it.
Yeah.
Yeah, so basically for the female, that's what it is. Exactly.
So to
Then-
say,
Sorry to cut you short. Then just to add on what Dr. has said, on the management also, as we have said before, you know, let's say maybe this mother, maybe she cannot conceive, maybe because he has fibroids. So we'll just remove the fibroids, then the woman will just conceive. Maybe, let's say maybe if she cannot conceive because she has a blocked tube. There's something we can pass there and blow the tube and she'll just conceive. Maybe, let's say maybe she cannot conceive because she has a hormonal imbalance. So we just balance the hormones and she'll conceive. Maybe the woman cannot conceive maybe because he has any pelvic inflammatory disease, which is a complication of STDs. Yeah, we'll just manage the STDs and the woman. So the treatment approach depends on the presenting factors. Yeah.
so to go back to Daktari, so how, when you say we don't buy these drugs over the counter, does it mean that these drugs are unsafe?
No, what happens is this, yeah? As I said, you need to be investigated. There's so many investigations that need to be done because you don't know specifically what is causing this infertility. You
Yeah,
get
that's
it?
true.
Yes. So you don't, you know, there's this notion where the neighbor tells you, I used this drug and it worked.
Yeah.
You get it?
Yeah.
So go also try it. And maybe your tubes are blocked. You get it?
And maybe hers was a hormonal imbalance. So she balanced her hormones, she conceived, your tubes are blocked, you go buy a drug to balance your hormones, but your hormones are okay. So it's a case, everybody presents differently. Yeah. So as the doctor has said, it's better to see a specialist and you'll be advised. And after that, you'll know actually what's happening to you. But not in every case you'll get that. Maybe you have a definitive cause of that infertility. Like in 10% of the cases, the cause of infertility is not known. It's idiopathic. You do all the tests for the lady, all the tests for the man, and everything is okay. So you get that these people, you've investigated, everything is okay, and they cannot conceive. Yeah.
Okay, now let's go live on our Facebook page. There's someone who wants to know, what's the best surgery to undergo when you have blocked fallopian tubes between normal surgery and laparoscopic surgery, and what's the advantages in terms of healing and safety? Doctor, you can take this.
You know, open surgery, what happens? You open the abdomen, take the tubes, try to use there's a sound that you use, there's a metal that you use to try to unblock. You get it?
Yes.
But laparoscopic one actually don't fully open. So the risk is reduced. Yes.
And also to add on like open surgery, I think we are getting out of open surgery slowly by slowly. Most surgeries nowadays are laparoscopic, but the problem is only the finances. because laparoscopic surgery is so expensive and most of us cannot afford. But also the advantage of laparoscopic surgery is for like it's more, you won't get a big scar, it's just a prick because it's a surgery which is done with the cameras. So that big scar won't be there.
But
so
she needs to know.
Yeah.
Is it a lady?
No. Rich Favor is a guy, I think.
Okay, he needs to know that actually the percentage is around 15% to be successful.
yes.
Yes.
Okay, and someone else wants to know, thank God you spoke about expensive. Is fertility an expensive venture?
Very expensive.
Oh my God.
Very. That's why you see gynas are having very okay.
They drive Mercedes.
You're trying to bring us down.
No, that
So
you know,
gynecologists are the richest doctors?
ask Dr. Yugi will tell you. I think after the leading surgeons are the plastic surgeons, then ortho, then gynas. Yeah.
So it's a very expensive venture.
It's so expensive because you know, as we said before, infertility, it takes two. It's a disease of the two. So you'll do a lab test for you, for your spouse. We do hormonal for you, for your spouse. We do a scan for you, for your spouse.
That's expensive.
Yeah. Then things the doctor was saying about IVF. Ask him how much it goes for, like a normal IVF.
It's quite expensive.
Yeah.
We're not going to ask. So what causes ectopic pregnancy and what's the reason that leads the fertilized egg not to move to the uterus? Also, how do you know that you have an ectopic pregnancy, since most women lose their lives when this situation develops? And on the same, I haven't finished. On the same, what are the first aids on an ectopic pregnancy patient before taking her to the hospital?
Okay, what I would say is, we discuss a lot of topics here. So ectopic pregnancy is a whole big topic
conversation,
that we cannot discuss there. So we can put it as one of the topics that we need to discuss.
Yeah. But just to brush over, because maybe the person is watching and maybe needs some answers, ectopic pregnancy is just a pregnancy outside the uterus. So it can be on fallopian tube, it can be on the abdomen, it can be anywhere but not on the uterus. That's the definition of ectopic pregnancy. So the early signs of ectopic pregnancy is abdominal pain, but it will depend with the stage, the gestational age of that ectopic, of that pregnancy. So you can have maybe severe abdominal pain, headaches, vaginal bleeding or discharge, and sometimes it ruptures. And when it ruptures is a medical emergency. So I think, as Dr. has said, maybe we can
tackle it as a
another day. Yeah, but it's a big topic. Yeah.
There's a question here. Who determines the sex of the kid, the man or the woman? I don't know what this means.
Yeah.
And also, when you're pregnant for twins or triplets, does it mean that the two eggs from both fallopian tubes are fertilized?
So the person who determines the sex of a baby is the man, because the lady has two X chromosomes.
Okay.
The man has X and Y chromosomes. So if the man donates the X chromosome, the baby will be a female. Okay. If he donates the Y chromosome, the baby will be a male. So it's a man who determines the
sex
of the... Oh yeah, another question was?
If you have twins, does it mean both eggs are fertilized from the fallopian tubes? Both fallopian tubes are fertilized?
Twins, we have two types of twins here. We have identical and non-identical. So you get maybe one egg was ovulated, then it separates in between, then you get identical twins. But unidentical twins, you get maybe there's ovulation of 2 eggs, and both of them were fertilized. Yes.
Okay, so Dr. Terry, that we mentioned that this fertility venture is very expensive. What does it mean for a common knowledge? Can NHIF cover it? Does insurance cover it? What do you suggest should be done as a policy measure?
I think it should be, because in our society, there are those who are poor, and actually they depend on the NHIF.
Okay.
Exactly. So if the government can take this one seriously, it can be a good thing. Yes, because it's quite expensive. Because as the doctor said about those investigations, they're very expensive investigations. Yeah.
So Ministry of Health, please check up that. Miriam also wants to know, can ovarian cysts affect one's fertility or chances of getting pregnant once they've undergone treatment?
There's one specific one that actually affects the fertility, and that is polycystic ovarian cyst.
Okay.
Yeah, but the others, they can be treated and it'll be okay.
Someone wants to know about NHIF. We've answered that. There's another one. This one is related to ectopic pregnancy and how affordable. We've answered that. Do eating habits affect fertility levels?
Yes, it
And
does.
what are some of the foods that one should be eating in order to boost fertility?
So, as we said before, there are risk factors of infertility. Risk factors of infertility, one is obesity. Another one is cigarettes. Another one is alcohol and drug abuse. Another one is lifestyle, like you are doing a lot of exercise. So you get maybe you've eaten too much and now you are obese. When you're obese, a lot of things happen because even hormones gets interfered with. So you get maybe people who are obese, the chances of them getting pregnant or the chances of them making a lady pregnant is normally reduced. So I think a healthy lifestyle will give you a good results. Like do a bit of exercise, eat healthy, don't eat junks, and yeah. So there's this food which are recommended, I think, for men, because you see men, for sperm production, we really need a lot of zinc. So things like watermelon.
I thought you'd say mgombero, but okay.
Things like watermelon, oranges, like groundnuts, they really help because they are rich in zinc. And when you are taking watermelon, don't throw away the seeds because the seeds is very rich in zinc.
Okay.
Yes.
And for women, guava leaves, any relation?
Guava leaves, I don't know. There's
a lot of if I take guava leaves, I become fertile on social media now.
I don't know. I've not read about it. Maybe I'll go and read about it. Yes.
Interesting. Anything to add on what to eat?
Actually, I say the most important thing is just to have a balanced diet.
Okay.
Yes, that's the most important thing. Yeah.
And just as we are finishing, can we talk about the psychological implications of infertility? Stress, losing your family sometimes, being chased away from your community because you cannot give birth.
Yeah.
Or such situations, especially to women. I think the women suffer the most.
I'll start with men.
Okay.
No, because you see, stress really affects the production of these major hormones, which controls the ejaculation and erection. For men, if you are stressed, you'll have something called performance anxiety. So you'll deliver before arrival. So you get maybe you have premature ejaculation when you have stress. You have like erectile
But
dysfunction.
I want to differ with you there.
Yeah,
Premature ejaculation actually released sperms.
yeah,
You understand?
Yeah.
So that one does not affect the infertility bit of it, right?
but you can only get pregnant after you've delivered the semen in the right place. So if you have premature ejaculation, meaning that you've not delivered
The definition is sperm into the vagina.
Yeah,
right?
yeah.
Exactly, that's the thing.
Yeah,
So you have premature ejaculation inside the vagina. So it does not give infertility.
oh, okay, I don't want to get there. We are live. So for women, you see, when they are stressed, the stress interferes with their menses.
Okay.
Like you get maybe their menses they get something called absent menses. But it's called when you amenorrhea. Yeah, so you get maybe you cannot have your menses because there's no ovulation.
Okay.
Yes.
What you said is true because actually it affects the brain.
Mm.
So the system that you're talking about,
Yeah.
it's interfered with
Yeah.
in a way that they cannot ovulate.
Yeah.
Yes. So, yeah.
Okay. Interesting conversations. I feel like we should continue with this infertility topic one more time. But as we are finishing, what would be your parting shot on infertility, Collins? Maybe do you offer those services at Nyaluk? Can people reach out to you for such?
Yeah, at Nyaluk, majorly we deal with sexual and reproductive health.
Okay.
And this is where we come in. Maybe a lady can't get pregnant or a man can't make a lady pregnant. So these are some of the issues we deal with. Then apart from this, we also deal with the gender-based violence. Now we are bringing environmental conservation at Nyaluk, and we are at Nasha Plaza, first floor. Yes, you'll always get us there.
Do you accept walk-ins?
Yeah, we do walk-ins.
Okay.
Yes.
Okay. And Daktari, any parting shots? Are you an expert? Can people reach out to you for infertility issues?
Yeah, actually I'm in innovation and I'm in reproductive health department.
Okay.
Yeah, and actually the last thing I would say, do not lose hope. You can always adopt.
Yeah.
Yes, you can always adopt if you really feel like you really need it. But us as professionals, we need to tell them that this is what it is. You can either get it or not, and there's a part now we can stop treatment, and yeah, and we'll advise you to adopt.
Okay.
So don't lose hope. Thank you.
And as the mental advocate that I am, I still remind us that kids come from God. Yeye ndo anapeana watoto, mambo mengine tuachane nayo. If you need help, please always consult with medical experts. And I think we're always here to answer any questions you have, even on this topic or any other topic. And if you have any other topics you'd want us to talk about on this show, please reach us on our SMS and WhatsApp numbers on 0736 991958 011 0100258. We are live every Saturday at 6 on Tumaini TV KE on YouTube and on Tumaini TV on Facebook. Until next time, have a lovely evening.